Pfizer's request to roll out vaccines for Americans as young as 5 years old cleared a key regulatory hurdle Tuesday after a panel of the Food and Drug Administration's outside vaccine advisors voted by a majority to back Pfizer's request. The vote is a crucial step towards vaccinations for younger children, but not the final word. If the FDA decides to formally authorize the vaccine, the Centers for Disease Control and Prevention must also weigh in with its own recommendations before shots can be rolled out. 17 members of the committee voted in favor of authorizing the shots and 1 abstained. The decision follows a day-long meeting of the FDA's Vaccines and Related Biological Products Advisory Committee, which has grappled for months with how to balance the benefits of the vaccine for younger children against the potential risk of rare side effects. Many of the panel's members voiced concern over some unanswered questions over rare side effects from the vaccine, but sided with allowing parents to weigh the benefits and risk for their children. Consultant pediatrician in the Obafemi Awolowo University Teaching Hospital, Ile-Ife, Professor John Okeniyi, joins us for more on this development. Good to have you join us, Professor Okeniyi.
Good afternoon.
So this is not a full approval. This is an emergency authorization. Talk to us about what this means in terms of the vaccination program.
The issue about emergency authorization is strictly for the United States. It is not a global thing, and each country will take its own decision. They have their own laws whereby when there is such a thing as a pandemic and a vaccine or treatment or protocol has not been extensively researched, there can be law permitting the use of that protocol or vaccine. That is what this is all about. The meeting has tried to evaluate the benefits and the risks of doing this, and they think it is to the advantage of the latter benefits, and therefore they are authorizing the use, and the use can go on while research still goes on as to a definitive position as to what to be done. This emergency use is for strictly for the Pfizer vaccine and not for the Johnson & Johnson or AstraZeneca. It is for children aged 6 years to 11 years. Prior to this time, they've been giving it to children older than 11 years. But this is not being done in this country, Nigeria, today.
But do you think that this could influence the practice in other countries?
Yes, it will influence practice in many places. For example, in some places, people just ape what is done in other countries without allowing due process in their own clime. We must realize that, yes, we're in a pandemic, it's a global event, but children have not been as worsted as adults. All the cumulative data till date, children are less than 16 or thereabout % of entire confirmed cases. Of hospitalizations, they are less than 0.2. And even deaths from COVID cases are less than 0.3 cases. Of all COVID deaths, those attributable to children are less than 0.3. And when children have COVID, amongst children with COVID, less than 0.03 have resulted in fatality. So there are other things to consider apart from preventing deaths when we're talking about extending these vaccines to children. Children may also partake of transmitting the disease apart from death. Then children may, having children still transmitting it and not vaccinating them, children may have lead to increased emergence of variants. So, but then we have had cases of deadly side effects, some heart inflammation in children who have had some vaccines. So I will still exercise caution. I will still say that yes, the United States has given emergency authorization. Other countries should follow suit in studying and thinking it through before they adapt it for their own local use.
And I was just going to go there because we know that the UK also is vaccinating children 12 to 15, and the UK has opted for just 1 dose of its vaccine, not 2 for children. But we know that, like you said earlier, some countries just copy and paste protocols and then implement in their countries. What would you advise Africa or African countries right now, especially Nigeria, if at all we're looking at this and we're saying, oh, maybe we should start thinking of children? What would you advise?
I will advise a country such as ours, Nigeria, where we are resource constrained, to focus on persons who are high risk of COVID-19. The vaccine is not cheap, it is expensive. There is a need to have equitable distribution of the vaccines. Persons who are elderly, diabetic, hypertensive, obese persons, and then amongst children, those who have higher risk for inflammatory issues, such as children with asthma, sickle cell, and those who are receiving steroids or anti-cancer agents and things like that. We should focus on them. I would not, as at this time, advocate a blanket vaccination of children younger than 12. That is my own position. But we have several positions, and this disease is still emerging. You talked about 1 dose or 2 doses, even for adults where they've talked about 2 doses. Now we're talking about boosters. We have many other diseases. I think in Nigeria, I may be wrong. I'm not speaking for the government. I think COVID-19 in children is not a leading problem, even though there has been fatalities amongst some cases. There's also been fatality from vaccination as well. There are more than 1,000 reported deaths.
All right.
So we have to be careful, look at the data, study it before we adopt it. And
we also have to carry out independent studies in our own country before we jump into this. Always great to have you on, consultant pediatrician, Professor John Okeniyi. Thanks for always talking to us.
Yes, have a nice day, everybody. Thank you.